On Tuesday, Nancy Messonnier, the director of the National Center for Immunization and Respiratory Diseases at the CDC, said this of coronavirus. Ultimately, we expect we will see community spread in the United States. It's not a question of if this will happen, but when this will happen, and how many people in this country will have severe illnesses. But National Economic Council Director Larry Kudlow then said, "We have contained this. I won't say it's airtight, but it's pretty close to airtight," end quote. And also, this is all on Tuesday, President Trump said of the coronavirus in the United States, quote, that it's under control and a, quote, problem that's going to go away. So that was all on the same day. Americans are scared of this situation, and they want to know what's being done to keep them safe. And hearing mixed messages like this within the span of hours isn't reassuring. Dr. Redfield, how can the virus be both a problem that's going away and also not a question of if, but when? What should we be telling our constituents about what to expect?
Thank you very much. I think it's a very, very important question. Right now at this stage, and I've said this and I continue to say it, the risk to the American public is low. We have an aggressive containment strategy that really has worked up to this time, 15 cases in the United States. Until the case that we just had in Sacramento, we hadn't had a new case in 2 weeks. We do believe we're going to continue to see new cases, and we do believe now there may be the initial cluster or occurrence of a community acquisition. Some countries, this has moved very quickly, like we saw in Korea now, where we had more cases in Korea in the last 24 hours than we had in all China.
Right.
We see it in Italy, it's moving fast. Iran, it's moving fast. But other countries have really used a containment and a blended mitigation strategy like Singapore and Hong Kong, and they've really limited the spread after the initial introduction from China. We're of the point of view that we're still in aggressive containment mode, which is dependent on early case recognition, isolation, and contact tracing, that now is going to be looking to identify these community introductions and practice public health to minimize them. But at the same time, we've done this to give us time, and I think what Dr. Messonnier was trying to say, I think it was maybe could have been done much more articulately from what the American public heard, was she was trying to say it's also a good time for us to prepare if we have to go to more mitigation. We're still committed aggressively to get aggressive containment. And I think I want the American public to know at this point that the risk is low. I want them to know that we are going to start identifying more cases like we did the other day. I'm going to ask them to obviously accelerate their own view of the standard things that we do for flu, hand washing, cough in your sleeve, don't go to work or school if you're sick. And we have launched a larger, for our next level of our multi-layered public health response, is to now institute broad surveillance. And we've initiated it. We're planning over the, hopefully the next 4 or 8 weeks, obviously linked to the supplemental, to actually make our surveillance system for corona the same as flu, nationwide. So we can be, very quickly picking up when there is an introduction in a community, go in and try to stop it. So I think that's our position at this point.
Good. Well, let me quickly ask you one other question in my limited time. I want to ask you to speak about the danger of xenophobia in a situation like this. CNN reported last month on disturbing example from the SARS outbreak when, and quoting them, people of Asian descent were treated like pariahs in the West. There were reports of white people covering their faces in the presence of Asian coworkers and real estate agents who were told not to serve Asian clients, end quote. We saw similar incidents during the H1N1 swine flu outbreak in 2009 and during the 2014 Ebola outbreak. And sadly, I've heard reports of incidents like this around coronavirus. So I'd like you to talk about why it's so important to avoid stereotyping people as carriers of the coronavirus and how incidents like these can be avoided and how they're dangerous really for public health.
I couldn't agree with you more. For those who've heard me talk before, I've always said that stigma is the enemy of public health in all its forms, whether it's in dealing with HIV, whether it's dealing with drug use disorder, whether it's dealing with obesity, whether it's dealing with a response to the coronavirus at this time. Stigma has no role, no place in public health. It's counterproductive.
So I think we're going to have to proactively get that message out to the American people so that we don't harm our own public health with stereotypes folks might have. Don't you agree?
Yeah, I will continue to echo it, and I think you make an important point because we have seen those reports, and I think, again, we need to re-echo that stigma has no role in public health.
Thank you, and thank you, Mr. Chairman. I yield back.